Let's continue our discussion with Dr. Shahid, this time about the AMC 1 exam.
This is just highlighting the cost involved in the exam itself.
Yep.
Just making an AMC portfolio and uploading your qualification cost about $600, and then the MCQ exam itself is about $3,000. But then you have to factor in that you'll be going to a different country, so the tickets, the visa,
Mm,
whatever cost that will be involved in when you're actually
yes.
staying in that country. For example, for me, I chose Thailand because that was the cheapest option for me at that point in time when I was doing my
Mm,
house job back in Pakistan. And similarly, for your clinical exam, it's a really expensive exam. It costs about $4,100, and on top of that, your visa fee as well as your ticket to and fro Australia, as well as your whatever time you've got here, wherever you'll be living, that adds on
mm,
to the cost. So it can add up to the cost. But one of the things I don't want people to think that this might act as a detrimental factor for them to make that decision, because ultimately once you start earning in Australia, then theoretically speaking, within within a couple of months you'll be able um, to make enough money that you can actually easily pay out all of this cost. It's just the initial
exactly.
cost when you're first actually starting to work. Starting to prepare for exams, then sometimes it can act as an extra burden of
Mm-hmm.
the cost of exam. But definitely in the long term, once you start working in a couple of months, you'll be able to compensate for all the costs that you've actually incurred
Sure.
in this process. So I've come through the AMC standard pathway, and that's what I want to discuss. And the next few slides are basically my personal experience.
Sure.
It's not everyone's got a different strategy of how they want to
Mm,
learn, how they want to go through the AMC pathway. And this is just my own personal experience, what I did. The
mm-hmm.
first question after the cost is that how much time do they require? How much
Yes.
time do they actually require in actually preparing for these exams? And these are lengthy, cumbersome exams which cost you an arm and a leg. And ultimately, there's no fixed answer. It really depends upon your circumstances. If you're exclusively studying and doing nothing else, it probably 3 months might be more than
Mm,
enough for you. For me, I took while I was doing my house job, I took that 6 months while doing my house job for the first 6 months. I kept on studying, and then I started for my the MCQ exam. But I was lucky enough to get rotations which were not that busy for those 6 months. So I had my afternoons and my evenings to
mm,
myself where I could study for those 6 months. Another question that I'm always asked, and that's something that I struggle with, is that how to study for an AMC.
mm.
Unlike
Yes.
the Kaplan courses for USMLE, unlike the QBAC that you have for your USMLE or the PLAB notes for your PLAB exam,
Mm-hmm.
the AMC does not have a fixed curriculum.
There's no
It does not have
standard. Yeah.
it doesn't have a fixed
Mm,
guideline of how to study, and whatever information that you might get from the AMC website itself, it's more generic, and it
mm,
lists about 10 textbooks, your McLeod's and your surgical books and whatever. It lists all those books and say, hey, read through these books and you'll get an answer. And unfortunately, when you run enough time, you want to be really efficient in how you study, and you can get these books, whatever I mentioned, even from your college bookshop. And the
exactly.
three books that I was given or suggested by the seniors were the annotated MCQs, the AMC Handbook of MCQs, as well as the Anthology of Medical Condition. And again, that's based on my personal experience, that I personally felt that I didn't get much from the annotated MCQs, so I don't
Mm,
recommend it to people who are now preparing for the exam. But I
mm-hmm.
just feel the backbone of your exam would be your AMC Handbook of MCQs, which is this book here. Now, it
Yep.
just tells you, it's a beautiful book which has questions and then answers and then explanations after those answers, which walks you through an entire topic, depending upon a clinical context or an MCQ. And it's really handy because you don't want to learn an answer, you want to understand the
Mm.
logic behind that answer. And that's where I really like this book. I would really recommend it page to page, cover to cover, at least 2 reads of this AMC handbook, because it gives you a good grasp of what to expect in the exam. And
Sure.
finally, anthology is something that you can probably just do pictures, because at times you want to know a spot diagnosis. And I've seen in some of the recent papers that they've taken some of the pictures directly from the anthology. And if these pictures have gone through your eyes once, then at least you can easily identify them when you
Mm.
see them next time around. Now, one of the
Sure.
biggest question that I'm always asked is which book to study, and this is where the question comes in. John Mortag's Clinical Practice is a book that's written by a general practitioner, and it people when I started practicing, I was told that this is the Bible of AMC, and if you don't read this, you can't pass the exam. Um, John Mortag is a brilliant book, but it might not be for everyone.
It's a
For
bit long,
example,
isn't it?
it's a book it's a book that is 1,600 pages long, and
Exactly.
it's really difficult to retain all that information. And at times things merge in one another, and it's difficult to recall. And I started reading through John Mortag, but I just couldn't go through it. Even after a couple of chapters, I thought probably whatever I was reading, I was forgetting. And then
Mm.
ultimately, for me, what worked was I started reading the Kaplan Medical series. Again, I might be biased in that regards, because while I was preparing for my final year exam, I was utilizing Kaplan on a frequent basis to
Mm.
actually go through my medicine and surgical subspecialties anyway. So it
Mm.
was a familiar territory for me. But definitely, when I was reading Kaplan, I was really nervous because people kept on saying that that's not the right thing to do, and I was just wasting money by appearing in an exam and just not reading John Mortag. It worked for me.
Mm.
That doesn't necessarily mean it might work for everyone, but I just wanted to put it out there that different things work differently for people. So
Mm.
if you can't read 1,600 pages worth of John Mortag, and if someone says you're going to fail your exam if you don't go through that, then that's not accurate.
Yep.
Um, and that's definitely if, for example, I was going through some MCQs and I couldn't find an answer, then definitely I would go back to John Mortag and try to find
The
an
reference,
answer
yeah.
to that question, and that became my reference book rather than
Mm.
my basic book. And I utilized Kaplan for to base my underlying knowledge.
Yep.
Ultimately, and I just want to put it out there. Basically, AMC, whenever you're sitting for that exam, it gives you a waiver that you are prohibited and you're not allowed to share any of the MCQs exam with any of your
Mm.
peers or your colleagues. But then everyone has a different strategy, and some people like to share their experience and write down the recalls from memory. Now, these are purely based on what they've memorized or what they think might have been an MCQ. Imagine setting a paper of, I don't know what, 100 questions, and obviously you can't memorize each and every question. So
Mm.
this is just people's perception of what the question have might have been asking or might have
Mm.
looked like to them. So some of the stems might not be accurate, some of the values might not be accurate, but it just gives you an idea of what kind of
Mm.
questions to look out for. And there's a closed group named by Emidex, and you can just ask the admin people, the administration of that group, to give you permission. They will want your AMC registration as a proof that you're actually sitting for your AMC. And once you've
Mm.
given that AMC registration to them, they'll let you enter the group in which everyone shares their experiences, some of the recalls, and it gives you a good idea of what to expect in the exam. And
Sure.
then finally, your Kaplan's 100 Cases of Ethics. It's just it's a small book, 100 cases, but it's very good for your psychiatry questions as well as your behavioral questions. And I found it really helpful because it's easy to read. You can probably go through it in a couple of days, and it gives you a good grasp and good understanding of what to expect in these behavioral questions. The last two, the therapeutic guidelines, are up to date. These are resources that might not be available to everyone, because for when someone's working in a healthcare system, up to date and therapeutic guidelines, they form the basis of your day-to-day management
Mm-hmm.
in when you're working in an Australian healthcare system. But these are subscription-based programs and tools that when you're working for the Australian government, it's free for you, but other people might have to like pay some hefty amounts for the subscription of it. But if someone has access, and in retrospect, if I had access to the therapeutic guidelines, then that's the only thing I would have read through to go through these MCQ exams. At the end of the day, the only thing, the tricky part of AMC that differentiates it from some of the other exams like USMLE and PLAB is that it isn't too, all of it is not based on your basic knowledge. They want to check whether you're up to date with the recent advancements as well, and they might ask you questions regarding some landmark trials or some recent research that has been published regarding a particular drug or their effect, and that's where it gets tricky. No matter if you read the handbook
That
of multiple
sucks.
choice questions, yeah, you read the John Mortag page to page, or you read Kaplan Medical, and even after reading that cover to cover, at the end of the day, you might still not be able to find an answer to that question, and then you have to Google, and you have to use your
Dig
up-to-date
it
or
out.
other
Yeah,
websites to find out what's the most recent guideline.
exactly.
Because at times it becomes frustrating as well, because if you read through the book, it will say that do A, B, C, D, right? And all those four options are all those four answers are the options on an MCQ, and then it becomes frustrating because you want to know what is it when all four options are in front of you, and that's when you have to look for, this is a clue for you that they're probably trying to assess that probably there's been a recent research article or some literature which has shown that one thing is better than the other, and that's what they're trying to assess. So that's the frustrating part, which I particularly found, that you can't get all the answers in the handbook, you can't get all the answers in John Mortag or Kaplan. But again, these are some MCQs that might check your knowledge, your recent knowledge, but that doesn't mean that you should not read the Kaplan, not read the John Mortag, whatever's your preference.
Before we go ahead, I wanted to ask how many questions, how many MCQs are there, and how long is the exam length?
Regarding the timing as well as the type of questions that are asked. So this is from the AMC website. It's basically a 150 questions that they normally ask, and it's delivered in one session, which is about 3.5 hours. And this table just summarizes the patient group that they're targeting. So they will be checking you for obs-GYN patient, pediatric patient, mental health, as well as surgery and medicine. So that forms the crux of your knowledge. There will be some questions about physiology. There will be some questions about biochemistry, but they don't form the basic. The basics would be formed by medicine, surgery, obs-GYN, pediatrics, mental health, and then general community health as well. But the AMC handbook itself, it's been distributed to highlight these patient groups so that you can actually understand regarding the specifications and what type of questions do they have to answer. And then there's some examination specification booklets as well. The AMC website has some MCQ trial exam as well that also has some additional exam questions and tells you what to expect, and then they might have some answers regarding that as well. So it's a really handy website, and the mcu.org.au, and it answers all these questions.
Sure. So that was all about the AMC 1 guys. Now we'll have to wait for MC2 for the second part.